nagbabalik po ang Doctors on TV. Mga kasambahay, we're still talking about epilepsy or seizures. Kasama pa rin natin si Dr. Ahoro, pediatric neurologist. So, Doctor, we talked about manifestations of seizure. It's a brain disorder na nagkakaproblema sa kuryente. Maraming manifestation, pwedeng as mild as blank stares, can be as severe as convulsions. May treatment bang seizures? Ay mga pagkain bang kailangan iwasan?
Actually, sa mga bawal, wala naman. Actually, we want them to live as normal lives as possible, no? Wala namang pinagbabawal, not unless their seizures is from a metabolic cause, kung saan nagkaroon ng that they need to have a special diet, no, to address the metabolic causes of their seizures, no. But other than that, walang pinagbabawal na pagkain. Prevention, mahirap anuhin. Unang-una siguro, before we go to prevention, awareness muna.
Okay.
Awareness that such a condition can occur, no? Kasi kadalasan, yun nga marami kasing mga myths about it. So, we have seen patients na ikinadena na lang sa gilid ng bahay because...
Even at this time, may mga ganyan pa rin?
Oh yes. I've been to a place in Palawan where there's a 36-year-old guy who has been having seizures since the age of 8 and has never been seen by any doctor up until the time we saw them.
28 years, kinulong na lang sa bahay.
Nasa kulong na lang siya sa bahay.
Hindi na lalabas, no?
Some of them are in the pig pens. Alam mo yun, sa kulungan ng baboy.
Oh, no.
Kasi nga, natatakot eh. At saka, syempre, yung pamilya, ayaw nilang malaman ng ibang tao na may ganun. Kasi akala nga nila, people might...
May lahi or in danger.
But, I mean, I always tell my children, I mean, there are famous people na may epilepsy, no? Beethoven is a person with epilepsy. Vincent van Gogh is a person with epilepsy. Danny Glover is a person with epilepsy. One of the Supreme Court justice in the United States is a person with epilepsy.
But it's a treatable disorder.
It's a treatable disorder. There are medicines that we can use to treat them. But ito, hindi to yung tipong, uy, anong gamot mo sa epilepsy? Baka pwede na rin yan i-take natin. No. You have to have the guidance of your doctor because like I mentioned earlier, depending on what seizure type you have, tinetailor natin yung medications na binibigay natin. Depende. Because there are some medications that can exacerbate a certain seizure type. No? So, be very careful then. Hindi porket, alam mo naman sa mga hypertension, uso-uso yan. Ate, anong hypertensive mo? Baka yun na lang, baka pwede ko na lang take yan.
Tsaka Doc, di ba merong mga minimeasure din yung blood levels ng ibang medication?
Yeah. We measure them, we don't routinely measure them, but for those patients na seizure pa rin sila ng seizure, tapos medyo adequate na yung dose na binibigay mo, then pwede mo siyang ipa-measure.
Doktora, before we proceed, meron tayong pahabol na text questions dito. Yung anak ko ay 11 years old na, di ko na po alam paano i-control seizure niya. Minsan bigla na lang bumabagsak. Ayan, Doktora. Ano ang question? Paano i-control?
Hindi na siya sa doktor.
Hindi niya nasabi kung naggagamot na.
Exactly. Siguro, first thing is, on her own, I don't think she will be able to control it. No? So, I mean, seek consultation.
Okay. Kasi kung kulang pa yung dose ng gamot, baka kailangan na i-adjust or palitan yun.
Hindi naman kasi yung dose na yun, yun kaagad yung tamang dosage. Meron tayong tinatawag na leeway, no? We titrate these medications. Hindi namin yan binibigay na isang bagsakan ganyan. Especially in pediatric patients, we are very careful, slowly. We start slow at very slow dose and we up-titrate slowly. Kasi syempre we also, I mean, like any other medications, some of these anti-epileptic drugs have adverse side effects. No? So, ayaw din natin yun. Start slowly, start low, and then go slow with the titration.
So, the expectation siguro of the patient should be...
Akala kasi na iba, pag kabigay mo, wala na eh. It's not a magic pill.
Kailangan bumalik sa doktor.
Yes, importante actually ang follow-ups.
So thank you very much, Dr. Jeannie, for joining us this Sunday morning and teaching us about epilepsy.
Yes, marami kaming
Marami tayong
natutunan
natutunan. Any final words po sa audience natin?
Well, actually, we have just, this is actually the last activity of the Philippine League Against Epilepsy for the National Epilepsy Awareness Week. We had a successful 1 week, no? We started last September 1 with a tripartite symposium on among neurologists on medical use of marijuana. And we are glad to say na we have arrived at a position paper. Hopefully, we will be able to publish this soon. And then, 2nd of September, we had the Epilepsy Exemplar Awards Night. We have actually awarded 6 persons with epilepsy who have done well despite their disability. And then, last Friday, we had the National Epilepsy Camp that was held in Lucena. No, we are happy to report that there were 130 plus patients with epilepsy. There were about almost 200 parents and caregivers, 55 teachers, mga barangay health workers, no, doctors and nurses who attended the camp. It was very successful.
Congratulations, Dr. Dr. Just in case any patient wants to seek consult with you, where can they go see you?
Ako sa Calamba. Calamba Doctors Hospital.
Okay. Do you have a contact number? I think one of the patients is interested in seeing you po.
Sa Calamba. My cell phone number is 0917-628-6386.
Okay. And lastly, Doctor, anyone that you want to greet po?
Actually, gusto ko lang konti i-promote lang yung iba pang activities for the lay, ano? Kasi baka, I'm sure marami pang gustong matuto ng konti. So, JR, meron sa September 18, sa Jose Reyes Memorial Medical Center. In Nueva Ecija, there will be a lay forum September 26, lay forum in Pampanga September 25, nurses forum sa Metropolitan Hospital September 12, Iloilo, they will have a lay forum in Miagao September 13, and then UERMMC will have a lay forum also on September 13.
Alright.
So yun po yung mga up and coming pa activities. These still are all in line with the epilepsy awareness activities.
Thank you very much,
that's
Dr.
very good,
Jeannie.
no?
Yes?
Yes.
Yes, oo. And thank you sa laging nanonood sa atin every Sunday. And hello, sana marami tayong natutunan. I'm sure marami, no? Maybe next time invite ulit natin si Dr.
Okay, so thank you, Doktora. Huwag muna kayong alis, mga kasambahay. Magbabalik pa po ang Doctors on TV.